Now that we know how to diagnose syphilis based on our serologic tests, detailed patient history, and detailed clinical assessment, let's talk about staging and treatment. Determining the stages of syphilis is based on the presence of characteristic physical exam findings and titers. When signs and symptoms are present, staging is either primary, secondary, or tertiary syphilis. You can distinguish between the stages based on the findings present on your exam. A key point to remember is that syphilis symptoms and staging is the same in pregnant and non-pregnant people. Let's start with the physical exam findings that are characteristic of primary and secondary syphilis. If there's a chancre, meaning a genital or perianal ulceration that is painful or sometimes painless with heaped borders, then the stage is primary syphilis. If there is a rash, a mucus patch, condyloma lata, or any of the signs we discussed in the previous video on clinical assessment, then the stage is secondary syphilis. If a person is asymptomatic, meaning there is a latent infection, the diagnosis is made based on their current syphilis serology, past medical history, and previous syphilis serologic results. State health departments can help you get prior results and treatment history if they are not available in your health system's records. Early latent syphilis is an asymptomatic syphilis stage where the infection has been present for less than 1 year's duration. The only way to confirm the duration of infection is to have a documented negative syphilis serology within the past 12 months. However, some clinicians will also rely on patients' history and medical records if they've been seen recently. The transition from early latent to late latent is an artificial line that has been placed at 1 year. In early latency, the disease is active but non-infectious. It means for the past year, the bacteria is present in the body but hiding in various systems and transmission is less likely. If you cannot determine the length of latency, be conservative and stage as late latent or latent of unknown duration. Late latency is a stage of asymptomatic syphilis that's been present for greater than 1 year. Suppose a person is asymptomatic and has a positive syphilis test result today. And we have prior information from over a year ago when the test was previously negative. In that stage, we call it late latent syphilis, meaning this person is asymptomatic and over 12 months ago, they had a negative test result. Now, if a person is asymptomatic and has a positive syphilis test result today, but we don't have any prior information about a negative test, then we'd stage this as latent syphilis of unknown duration, meaning this person is asymptomatic and we have no prior records of a negative syphilis test. And so it's not clear when the infection may have occurred. The latent stage can last a lifetime. If left untreated, some people will go on to develop tertiary syphilis 10 to 30 years after infection. Tertiary syphilis is rare. It can cause damage to the heart, brain, nerves, eyes, blood vessels, liver, bones, and joints. Symptoms may include difficulty coordinating muscle movements, paralysis, numbness, blindness, and dementia. This diagnosis is complex and involves specialists, imaging, and lumbar puncture. This stage is not contagious, but the symptoms can be life-threatening. Congenital syphilis is when there is vertical transmission of T. pallidum from a birthing parent to the infant during pregnancy or delivery. Note that symptoms of syphilis present the same way in pregnant and non-pregnant patients. Neurosyphilis occurs when there is CNS invasion by T. pallidum. Neurosyphilis can happen at any stage of syphilis, so it's important to screen patients for it and treat if necessary. Neurosyphilis screening. When patients have a positive syphilis serology and are being treated for syphilis, it is important to screen everyone for these coexisting ocular, optic, and neurosyphilis infections. These are the questions to ask when screening for syphilitic ear, eye, and CNS involvement. Let's do a knowledge check. Question 1. Match the syphilis stage with its characteristic symptoms. The stages are primary syphilis, secondary syphilis, tertiary syphilis, and latent syphilis. The characteristic symptoms are A. Condyloma lata, mucus patches, B. Genital ulcers, usually painless, C. Asymptomatic but positive syphilis serology, D. Cardiovascular damage, and gummas. Correct matches are primary syphilis, B, secondary syphilis, A, tertiary syphilis, D, latent syphilis, C. Question 2. True or false? Neurosyphilis can occur at any stage of syphilis and requires screening for ocular, otic, or CNS involvement in all patients with positive syphilis serology. Answer: true. Neurosyphilis can happen at any stage of syphilis, and so it is important to screen patients and treat if necessary. Question 3. What distinguishes late latent syphilis from early latent syphilis? A. Presence of a chancre, B. Rash on palms and soles, C. Duration of infection longer than 1 year with no symptoms, or D. Presence of mucus patches. Correct answer is C. If the duration of infection is less than 1 year, then the diagnosis would be early latent syphilis. If you got all the questions correct, excellent job. If you missed a question, don't be discouraged. We recommend reviewing the video and the resources below for better understanding. Learning is a journey, so let's keep exploring.